Good morning, and thank you for joining us for this opening session. Along with Convatec, I would like to welcome you to this symposium titled From Motorola and Toyota to Your Wound Care Program, Leaning into Six Sigma to Optimize Clinical and Economic Outcomes. I'm privileged to introduce our speaker today. Jill Imethen, a certified wound ostomy and continence nurse, is the wound ostomy care coordinator for the Bethesda Health Group, a St. Louis-based senior living, healthcare, and service organization where she has served for over 20 years in multiple roles. Jill is a 2013 graduate of the Maryville University School of Nursing and went on to complete the wound ostomy and continence program at Emory University and certified as a CWOCN through the WOCN-CB. Jill has successfully incorporated Lean Six Sigma principles in implementing the Convatec Complete wound care program in the Bethesda healthcare communities. She is also currently leading a clinical research project aimed at reducing acquired pressure injuries in the post-acute setting, which she hopes to implement throughout the Bethesda healthcare communities. Jill is the 2021 recipient of the Leading Age of Missouri's Employee of the Year in Client Services Award. Thank you again for joining us this morning. Please submit your questions in the Q&A section, and we'll look to get to them at the end of the presentation. Jill?
Thank you, Julia, for that introduction. Welcome and good morning. I'm so excited to be kicking off this Friday's education sessions here from St. Louis, Missouri. Here are my disclosures. I am KOL for Convatec and currently doing a clinical study with Medline. So here are our objectives for this morning, talking about the 5 components of comprehensive wound care program and how it was implemented throughout Bethesda, and talking about the Lean Six Sigma components that actually allowed us to take on and look at wound care holistically. And then finally talking about the clinical pathway that was developed to drive our consistent outcomes. So I want to give you a little bit of background information about Bethesda Health Group, just so you have a frame of reference in your mind when we talk about how this project was rolled out throughout our organization. Bethesda has 7 locations throughout the St. Louis area that provide long-term care, post-acute, home health care, and hospice. We are a mid-sized company and we are non-for-profit. So looking at this next slide here, I want to talk about where we were as an organization before we introduced and implemented the Convatec Complete program. First of all, we had diverse products and treatments with over 200 different foams out there on the market and over 150 different silver options. You could see that we had all kinds of options. We weren't able to narrow it down to one specific product. We had product, but not all of it didn't follow evidence-based practice. Therefore, we had inconsistent care protocols. There was no pathway to give guidance. It was just whatever anybody put in as the order. So in my experience going to nursing school, all I had to do for wound care was a sterile dressing demo. And then also I had probably about a quarter of a chapter on pressure injury. And I can understand, just in talking with our physicians, they had about the same amount of education for wound care. So we would have nurses that, maybe worked with wound care nurses, 15, 20 years ago, putting in orders for this type of treatment. And then 2 weeks later, we would have another nurse come in and say, no, that's not the right order. We need to change the orders and do this. Then a couple weeks later, orders would change again. So after 4 or 5 weeks, we were scratching our heads Why isn't this wound healing? Well, probably because we've had 3 or 4 different treatment options. Inefficient care processes, not just from a nursing standpoint, but also from a materials management standpoint. Nurses would go to Central Supply. They wanted to know where their product was. Central Supply was responding with, well, I don't know what you need. This is something that we don't normally have on the shelf, and we don't know how much to order for you. So following from bringing that person in from the hospital to post-acute and being able to provide a continuum, we didn't know what products were needed, how much of what product. When we move on to looking at care plans, well, we would write lovely care plans, but then we would look at the orders, and the orders didn't match the care plans either. So there was inconsistency there. And when we talk about mismanagement of wound bioburden, lack of communication on wound progress, and then specifically stalled wound healing, we were having focus meetings every week. But those focus meetings were more like a reading of the wounds. Margaret Smith has a cossageal wound, and this is the treatment that we were doing. We were not having dynamic discussion. Well, Margaret Smith has been on this list for 7 weeks now. What's going on? Are we addressing the stalling of the wound? Are we addressing nutrition? None of those conversations were happening. So when you look at all those kind of multicolored bulleted points at the bottom here, add in staffing challenges. So we had that with agency staff coming in, float pool staff coming in, and of course they were changing orders as well. When we had our state surveyors coming in, we were getting, dinged for, well, you have this care plan, but your orders don't match. And then, of course, the talk about reimbursement. Can that possibly happen? That wasn't, really even an option for us at that time. So we looked at an assembly line, just like the title of the presentation here. When you think of an assembly line, Toyota and Motorola, when their product comes off the line, their intent is to have a finalized product without defects that hopefully they don't have expensive recalls later down the line. In the same token, when we look at wound care, we have similar goals. At the end of this, we want to be able to heal the wound or maintain the wound. We want to have a wound that's not infected, and we wanted consistent outcomes. Both of those, whether you're looking at a vehicle or other product and wounds, we want an efficient process. We want to take out the steps that we don't need, and we want to look at the people that are actually a part of the process to come together. And it's not just nursing. So sitting down, we sat down with Convatec to develop a project charter. We knew what the problem was. All those things listed on the previous slide with the bullet points. Our wound care was basically, like I say, tore up from the floor up. Our systems were not in place. And so we began to lay out goals. And the goal was to redevelop our closets aligned with Lean Six Sigma in mind. Provide education that is evidence-based, surrounded around wound hygiene for our nurses, and empower our patients who were discharging home out of our post-acute so that they were confident in doing their wound care at home. We also had to have a timeline. How long was this going to take as we rolled this out through all of our 7 locations? And we wanted to look at who those key team players were. Our corporate director of clinical services, myself, the leaders at Convatec, our distributor, MedB, all of those components coming together. So this was our roadmap. And we began to look at Convatec as a true partner in solving this dilemma instead of just another manufacturer that's there just to put product on the shelf. So using and keeping Lean Six Sigma in mind, we began to implement the 5 S's. So getting together and looking at our SKUs, of the products that we had. So the sorting, putting together a process of who our team players were and what needed to be set in order. We knew that we wanted this to be simple and easy as it looked in the closet to shine, to make the product shine. We wanted to be able to replicate this. We had to do this in all 7 of our buildings. So we wanted it standardized. And then we wanted to be able to keep it going, so sustain it. And then once we had all those elements in place, we wanted to be able to look back at the analytics to have an objective way to see where in the future, as we move along, where we can make improvements in the process. So I love this puzzle piece picture with the 5 various components because it really demonstrates how each piece flows in and is connected to the other and dependent on the other. And it's very fluid in the movement and in the process. So when we looked at our first step, product standardization, this was bringing materials management, central supply, nursing together. We're on the floor looking at products and what we're using. It was really nice because both from a clinical standpoint and materials management, we started seeing an empathy for one another's roles. Nursing would always get upset because they'd go downstairs, we need this product, and where is it? Where materials was like, well, how are we supposed to know what you need and how much you need of it? So the light bulbs started coming on in that regard. And with having over 200 different brands of foams and over 150 different silvers and hydrofibers, everybody could clearly see, we needed to pull this and lock this down together. So we started asking ourselves, what products do we currently have? What products are utilized the most in the buildings? What products are actually needed at bedside? We wanted to keep this simple for the nursing process, not confusing for our bedside nurses. And then really honestly, how much space do we have in the closets? So in doing that, we came up with our formulary here. And you can see on the page, those that are highlighted in yellow were our highly everyday utilized products. The other ones were available and always available to use, but just not used as frequently. And so we were able to code these. These have, the distributor number, the HCPCS code for Part B. All of that was seamless and streamlined. So moving into that second component with bringing in our distributor and talking about the analytics, I want to give you kind of a picture, and some of you might be able to agree now with where you are. We would have quarterly reviews, but the report was, well, this building is spending $25,000 in wound care. Okay, great. But it wasn't specific. Was it foams? Was it hydrofibers? None of that. So in bringing in our distributor, we were able to get analytics to where now when we have our quarterly reviews, we're having nice discussion. We're looking at these numbers and the graphs that show how much building 1 is using for foams, how much silver building 2 is using. And a lot of times the question is, we'll see trends, as trends happen, this building is using a lot of foams in the past quarter. And they'll ask me, Jill, why? Well, half of their census is wounds, so that makes sense. Or we would look and say, no, that doesn't really make sense. And that gave us the ability to pivot and really look at that building to see what's going on. And it was nice also to have Convatec come in and pivot with us as we really started drilling down what was going on. Maybe we needed more education about the dressings and the use of the dressings. So having that accountability. With having a distributor who was also Lean Six Sigma minded, we were able to put together the bins that had the labels with the picture of the product, the codes, all of that really helped us with setting an order and shining. They also serve as a gatekeeper, because now when things come through to our distributor that if it's off of formulary and not what we put together on formulary, our distributor is actually reaching out to us, the director of nursing or myself, putting those brakes on, saying, hey, this building is asking for products that are not on your formulary. Do we need to send them? And we're able to go and investigate. Do we need to send these products? Is this a situation where we need to provide education for the medical director that's ordering this? So on and so forth. So here's a picture of the closets before. You can see varying products all over the place, varied par levels. Looking at each of those individual little labels there, you can tell as a nurse, very difficult to go in there and try to hunt and peck what you need. And oftentimes we were running to different closets to get all of the pieces that we needed for the dressing procedure. So with the Lean Six Sigma process, with the supply closet, this was our prototype. We wanted something that was going to flow in the same order that the nurses would pull off shelf in the order that they would do the dressing change there. We also had what we considered specialty items that we used a different color bin. So like the Aquacell AAA Advantage or those sacral foams that maybe were more, cost more, and we wanted a little more control over. In fact, when we were going through and organizing closets, there was one of our very first location, there were 7 boxes of Aquacell AAA. And I kind of raised my hand and said, nobody on this floor has orders for this right now. And so the director of procurement was very quickly, when's the expiration date on those? And so we were able to look and fortunately, redistribute those out to other buildings. So just kind of giving you a taste of what it was before. The truly materials management didn't know how much product to order. They were guessing. Here's a picture of our very first rollout at our very first building, bringing in materials management, our distributor, our director of procurement, and myself, putting those carts together, getting ready to take them up to the central supply closets on each of the floors. And the before and after. So now you can clearly see they're in clear bins, nicely labeled with the picture of the product, has a flow, a reason, very simple for the bedside nurses to follow. And for somebody short like myself, I was actually able to see what was in the bin. So that was nice too. So aligned based on care, you can see our expert items there. This is our second rollout. So you can see the before and after. So same process, moving it along to standardize. The picture there on the far right shows all the bins we were actually able to clean out and get out of the way as we went through and organized our closets. It was fun because afterwards we would take the nurses and central supply team to the closets and show them, and they started to say, wow, can you do this for like our IV supplies and our tube feeding? So we were able to, look at bringing that into other services as well. These are photos of our main central supply closets. We wanted to replicate what we had up on the floors into our main central supply closets as well. So you can see here the before, the after. our director of procurement wanted par levels set that 80% of what we had in the building was up on the floors and 20% of what we had was in central supply. This really allowed the central supply employees to be able to know when they needed to order things. Like I said before, they were just guessing. So this really gave them a clear-cut picture of when to order. And you can see affixed there is the formulary. So they had the order numbers there ready to go for them. So moving into our portfolio management, the third component here of the process, we partnered with a Med B supplier. This was nice because it allowed, again, for consistency. It was another area that was helping us with consistency. When they have to submit their paperwork for reimbursement, certain boxes need to be checked. They have to have a debridement. They have to follow. They can't send supplies for daily foams. These dressings are meant to stay in place. So in bringing in our Med B teammates, we were able to provide consistency across the board, even into our long-term care residents. So they were being provided the same products that we had in post-acute. We were also able to provide that education to the nurses on the frequency of dressings and following that process, educating the nurses that when our patients in post-acute discharge home, they are not going to be getting supplies that support daily dressing changes. So bringing in our Gensis, our Med B supplier, they also help as a gatekeeper, bringing up, oh, we're starting to see some daily dressing changes. This might be an opportunity for re-education. We were able to look at putting together a crosswalk. So they were able to put a list together of all the SKUs that we were seeing coming from the various hospitals and giving the nurses at bedside a clear pathway and crosswalk into what the products were on our formulary. So if they saw this coming from, this location, that this would be the like product that they would use on their formulary. When we looked at discharging residents, we wanted to be able to incorporate the CARES Act. Back in 2019, before COVID, the AARP had an article that talked about how we had over 250,000 seniors that were receiving care in home, and their caregivers were really concerned that they were being discharged from the hospital very quickly, and they did not have the tools and education that they needed to be able to carry on that care in the home. So in bringing in our Med B partner, we are able to, at discharge, actually have discharge planning to where we are connecting the patient with having supplies, the same supplies that they received and saw with us are now able to be continued in their home through our Med B supplier. Even at those that were going home with home health, what we're seeing now with staffing challenges is sometimes our patients are waiting a week or 2 weeks before home health is able to get in there. So our partner is able to fill that void with the same quality dressings that we have in our communities that were used on our residents and patients now being provided at home. So being able to implement that CARE Act and follow that was huge. We have this handout here as an example. The patients get at admission, this is how you clean your wound. So they can replicate that at home. And also affixed to that is our Med B supplier. So if they have questions when they discharge home, they have a contact. So talking about education, the fourth component, we have so many resources now that we did not have before. So we have these QR codes affixed to our treatment carts and at our nurses' stations, along with those crosswalks, that very easy. As I said, we have agency coming in, we have new staff coming in. So for training, it's very nice to be able to send them over. They can scan the QR code and watch a 1 or 2 minute video on the principles of moist wound healing, what is a hydrofiber, and how the dressing should be used. As we rolled out the program, not only did we, implement those resources, but we also had a test and competency surrounded around wound hygiene that I would go and train the nurses and nurse managers on as we rolled and implemented each of these steps in the building. And again, pointing out, the handout, because it really was an opportunity for see one, do one, teach one. Our nurses have this sheet on how to do a proper dressing change that is actually guided by CMS guidelines. And so they have this as a cheat sheet in the building. Then our patients are also seeing this. So they're watching their nurses clean the dressing. They're able to demonstrate to the nurses how to clean their dressing so that they are empowered and successful with going home to replicate that for our residents that are going home. And then finally, our clinical pathway with wound management. Based on the 2020 consensus document on wound hygiene, Convatec was able to present us with this clinical pathway. It guides the nurses through the assessment process, things that they need to be looking for, how to appropriately and effectively clean a wound so that we're addressing biofilm at each dressing change, how to debride that wound mechanically, looking at the wound edges, and then finally, what dressings do you want to choose based off of what your wound looks like? And it has pictures of what products to grab on shelf. Amazing, because now we are essentially spoon feeding our process to our staff. This is something that our medical directors have a copy of. It's a part of our policy and best practice. It is also something that's up on the treatment cards and at the nurses' station so they can, follow our pathway. Also gives them guidance on who to contact and when to contact if they suspect, things are happening with the wound, when to reach out to the physician, when to reach out to the nurse manager. So now the results, this is what we want to know. So kind of thinking of the drum roll in your head, if you will. What does this look like now? Okay, after we implemented this, where are we at today? So from a materials management, we now have reports that we are able to look per facility, per product, per day, what we are using, and the types of foams and the type of products. With the integration of Lean Six Sigma, we have the 5 S's, the sort, shine, sustain, carry on, and standardize through our communities. We have bins that are numbered with a number order for easy ordering for our materials management team. We were able to reduce our SKUs from 29 to 10. We now have par levels so that central supply knows when they need to reorder a product. They're not just guessing. And we were able to carry this into other product lines as well. And here we go. 6 months later, the closets still look the same as when we set this up. So that's phenomenal. And let's look at the numbers here. So, we have 7 of our locations. Building number 7, we actually brought on to the organization in April of last year. So that's why you don't see the numbers there. But if you look at the left of your screen in Q1, where we were where each of the buildings were, and then follow through to the far right where we were in Q4. So you see a drastic change in cost there. And then when we are looking at the quarters, so at the top of the screen, you see Q1. So this is this year. And then if you follow down at the bottom of the screen, it shows you Q2 of 2021. So where we were well before we carried out these components and this process. And you can see the numbers, going from $2.08, bringing that to $1.42 now. Even our building that we brought on new within the organization, going from $14.34 to $8.61. The per day spend, so getting down to the pennies, 63 cents per day down to 41 cents per day. Bringing in and looking at our Part B and the impact that we had, this number is reflective from December of 2022 through March, this past March here, and the total cost savings. We brought them in kind of in the middle as we were rolling out. So I'm sure the number is significantly higher by now. Total supplies ordered, patients served, and the different percentage at a sample of our buildings. And then looking at, surgical dressings, that $9,940.31, that was money that, that was product that was coming from and provided to our long-term care residents through Part B, and not just our organization. So feedback, perhaps probably the biggest, thing that materials management, Central Supply had to say was this is going to help with back orders, because that has been the name of the game since COVID. So now they know what they can anticipate to order, so they can plan and order ahead and hopefully, be able to stave off some of those back orders. Administration, having this for our medical directors, we're aligned, it'll decrease variance, having that set formulary, very easy for our new nurses because they'll have basic options. It's less confusing. Even materials management, this is too many choices. It was too confusing before. And then from a clinical standpoint, I do have some case studies here we'll show after this slide. But looking at these dressings are high quality dressings. So we're not needing to change them every day. So patient comfort from having daily dressing changes that aren't pleasant. From a nursing standpoint, it's saving nursing time because, yes, wounds are a highly litigious area, as we all know, and a big focus, but there's other things going on with that patient as well. So to be able to save that nursing time is huge. Being able to collaborate with Part B, so we have a consistent follow through with dressings from rehab to long-term care to even our patients that are discharging home. Being able to follow evidence-based care with following the wound hygiene and the way that the dressings should be used. So our first clinical study, we have a 67-year-old female, past medical history there, kind of alphabet soup. It's kind of what we see in a lot of our patients. And these were chronic venous wounds. Before, when I spoke to her, what products was she using? She just everything. We've tried everything under the sun. So we went in and used the Aquacell AG Advantage with Convimax. And so these were, again, chronic wounds. And you can see from going from week 1 all the way to week 3, seeing the healing. And she had a couple wounds here. So this is the left anterior shin. The left calf. And then the right anterior shin. And I can say that by the time this patient discharged from our rehab, these wounds were healed. Case study 2, this was one of our long-term care residents, actually, again, with past medical history. We have type 2 diabetes in here, history of pressure injuries. She was very non-compliant. She propelled her own wheelchair, very much a social butterfly. So digging those heels in as she moved, to bingo and things like that. So we used Aquacel AG again, covering with an Aquacel foam, changing the dressing every 3 days. And so looking at that heel, that left heel wound, you can see the healing over 3 weeks. And I can tell you that this wound, has since been healed out, and we haven't had any further issues. Nothing has come across my desk anyway to come out and do a root cause analysis there. And then finally, case study 3, unstageable right heel wound with our 87-year-old female. Stroke, chronic kidney disease, hypertension, history of being a smoker. This patient actually admitted, had these wounds at home, went to the hospital, came to us, and in asking her, okay, what are some of the things that you used at home, things that were used in the hospital? They were using ABD, MediHoney. So we changed it up with, incorporating, of course, our wound hygiene practice with all of these. Our Aquacel AG, Advantage, and Aquacel foam change every 3 days. And you can see here with this, we were able to, that eschar there on the heel within the next week started to kind of remove itself with the dressings. So from a clinical standpoint, the nurses were also saying, it's nice to have these basic options, so much easier to go to the closet and follow. So simple. It makes sense. This is going to make consistency so much easier. And again, they were, hey, we need this for all of our products. Can we do it for everything? In the past, having all those different products on shelf was just confusing. So they really appreciated having just this basic options available for them. I'm going to turn it back over to Julia for any questions.
Sure. Thanks, Jill, for a very informative session. And we do have some questions for you. So the first one is, was it challenging to get the senior leadership of your organization to commit to the standardization of the wound care processes and products under this program?
No, not at all. I feel everybody had a vested interest in getting wounds under control. So it was really easy, partnering with our corporate director of clinical services to really get this program off the ground. We all had a vested interest in getting this going.
Okay. So you've shared some of the clinical outcomes with the program. Have you seen your wound care outcomes improve overall in using the Convatec products with the wound hygiene protocol?
Yes, we have. It has been nice to see. We have, we're able to heal more wounds out. We're able to really make that connection, especially with, because yes, we would love to heal all the wounds, but sometimes maintenance is appropriate. Really being able to provide the consistency even when they're discharging home has been huge, and very powerful and impactful for our patients when they go home, setting them up for success. We are receiving those phone calls, and it is reflective in our feedback surveys that the patients are really appreciating seeing this and using these products in our buildings, and then being able to also have the same products, quality products, provided for them at home as well.
Okay, great. So how do you account for patients that have multiple wounds or highly exudative types of wounds when you're looking at your numbers of wound care dressings that you're using?
As far as like from a day-to-day, or like looking at like from a quarterly review standpoint for accountability?
Right. So you were talking about trends and looking at them and kind of drilling down to, the root cause of why the increase, and how that plays out in your decision making.
So, so looking at those quarterly reviews, it is definitely something that, in those quarterly reviews, our chief financial officer and chief operating officer are sitting there. So they're definitely wanting to know, hey, why are we having an increase in, use of silver at this building or this building? A lot of times now we're able to say, well, word is out that we are a preferred provider for wound care in the St. Louis area. So we are seeing an increase with census with patients who have wounds, especially at one of our locations in particular. Half of their census are wounds. So, that really, is impactful. So it does correlate with why we're seeing that. Of course, if we're getting more patients, higher census, higher population with wounds, then we're going to be using products more often.
Okay. Did you run into any obstacles, such as the physicians not agreeing to the wound care, the frequency of changes, and how did you work with them to resolve those issues? Do you have any kind of helpful tips for the clinicians to use with the physicians?
Really, it was so our medical directors at each of our communities were on board. They were vested too. They wanted to get this, beast, if you will, under control. Nurses were, hey, game, because when I was able to get buy-in from the nurses, because I'm like, look, I'm working the floor as well with the team of patients sometimes. I don't want to do daily dressing changes. I want to save you time. So really quickly, the nurses were like, yeah, we're on board. Where we sometimes ran into having some challenges with some of our outpatient providers. So we would have some patients that were, they were post-acute patients that were going to like an outpatient wound clinic. And that is where we were seeing then now, where we see some of these erroneous orders that are not formulary. So it's been nice because with our partnership with Convatec, it's not just us going at it to try to educate that provider at the wound clinic on what we have here and why we have the process. It's nice to have Convatec in place to also go out to those wound care centers and provide the education on the dressings as well. So I would say that's probably right now at this point, where we're at as far as having some challenges.
Okay. Did implementation of the program make your facilities more comfortable in admitting those patients with more complex wounds?
Yes, because we have a process now. even like I said before, having agency and even staff turnaround, we have all those tools, the education, the clinical pathway that guides you directly on what to place, definitely makes the nurses more comfortable and feeling more confident in using those dressings. And it's something, those educational tools, it's not just, hey, this is on the treatment cart, look at this. We have incorporated this in our online learning that we have to complete every year, with the videos and the wound hygiene as well. So really building that confidence and empowering our nurses to feel comfortable.
So you said prior to implementing the program, you didn't really have a clear understanding of the organization's wound care costs from a drill down to a product level. How has the program helped to stabilize your wound care costs?
We are able in those quarterly review meetings to have that accountability. We are looking at each of those buildings. So building number one, okay, we're seeing an increase in foam usage. Why are we seeing an increase? Is it truly because we are admitting more patients that have wounds because word's out that we have a program in place? And we're having positive outcomes because of our partnership with this program? Or is it because we're having nurses putting orders in for daily dressing changes? We're able to drill that down and look at the orders with all of our partners involved, from our distributor to Med B, really looking at it and then bringing Convatec in as well. Sometimes we are pivoting and going to a building saying, yeah, your increase in foam usage is because you're writing orders for these daily dressing changes. Let's provide this education on how these dressings are meant to be used, if that answers the question.
Well, I think it does. You talked also about specialty dressings, and the different shapes, I should say, of the foam dressings are in that category. Do you use foam dressings for skin protection?
We typically do not use foam dressings like as a prevention, like a prophylactic prevention. The hospitals here in the area definitely do, because they're with them short stay. We have to look at it more long-term solutions, because our Med A patients, our rehab patients are at least with us for at least 100 days. So we bring the foams out, the sacral foams or the heel foams, when we have wounds present there. So those are considered specialty products that we're really bringing knee on board, because those are definitely pressure injuries that I'm diving into as well.
Well, that's all the time we have for this morning's session. There have been a number of requests for the clinical pathway and a download of the session. So we will be providing that after the conference. So thank you for those requests. And again, thank you for your participation in the session and all of your very engaging questions. And we hope that you are able to enjoy the rest of the conference. And we encourage you to stop by and visit the virtual Convatec Advanced Wound Care booth to learn more about how our products can help you improve the lives that you touch. Thank you, and enjoy the rest of the conference.